If you want to go from university nursing student to registered nurse, you have to pass a standardized test. There's a brand new one this year, and it's called the NCLEX.
Failing the NCLEX was the worst moment of my life. It was the death of a dream. I was very, very upset. I was distraught beyond words.
This graduate nurse, who asked to remain anonymous, is part of the first cohort of students to write that test. It's the American exam. The Canadian governing bodies of nursing are switching to the American exam, and Alberta is among the first to make the move. Pass rates have plummeted. In the first 6 months of the American test, the pass rate has gone from 90% with the old test to 68.7%.
The American schools teach towards the NCLEX, and that's not, like, their entire lectures are based on what you are going to be writing on the NCLEX and like you were writing the NCLEX. Their exams are like you were writing the NCLEX. Ours were not like that.
The College of Registered Nurses, which selected the test, said it should be no more difficult than the old test, just better.
We selected that exam because our exam at the time was a paper and pencil exam. And we only had it offered on 3 days per year, and we had over 10,000 writers in Canada. So administratively and logistically, it wasn't working very well for us.
The Dean of the University of Calgary's nursing school understands those reasons, but she's concerned the NCLEX is too specific to the United States' very different healthcare system.
We know that the students are not any less competent this year than they were last year. They're not any less safe this year than they were last year.
Nursing programs across Alberta are teaming up to figure out what they can do to help students. Those who failed their first one will have another 2 chances to try again.
I think that we'll keep doing more of what we've been doing already. We've learned from this first round, and I think that we'll continue to help our students be successful.
And Bridget joins us now live. So Bridget, what makes this exam so hard besides, of course, its focus on American healthcare?
I'm going to be honest, Tara, it sounds awful. It's a computer-administered test, and it randomly picks questions, different ones for everyone. If you show a weakness in one area, it'll continue to throw those kinds of questions at you until you can answer them. This could go on for up to 6 hours. Now, that kind of randomness is good for security, of course. It's not like you could cheat off the person next to you, but it also makes it difficult for nurses to prepare for. Add in the focus on the American healthcare system, and the exam sounds like a doozy. So the dean recommends students do the practice exams that are available.
Wow. Okay, Bridget, thank you.